Hey everybody, welcome back to my channel. Michelle here. Looking a lot better than yesterday. I would hope. I did a video last night, a handheld video in my pajamas to try and get it knocked out so I could give everyone an update on what happened when I went out on Saturday. And I'm sorry that I'm looking at myself. I hear a lot of YouTube people say, sorry that I'm looking at myself. It's almost impossible not to look at yourself and look at your hair when you're doing these videos. So bear with me. I'm sure when I get up to speed and have hundreds of videos that it'll get easier, but for right now, it's not. I saw a question on another person's page asking someone to do a video for the types of tests and things that are required before bariatric surgery, so I thought I would do that. I need to state, like I did in my introductory video, that I am self-pay. I'm an RN, and my insurance does not cover this surgery, unfortunately. So I'm doing this for myself. It's a gift to myself that's going to last me the rest of my life, and to my kids. So it does vary a little bit in what is required by the insurance company. I know this from experience, what's required from the insurance company versus what's required when you're self-pay. It's a little bit different. Your surgeon should always be safe, should always do the proper blood work, should always do an EKG, should always do everything that's required to make sure that you're healthy enough to tolerate this surgery. But if your insurance is covering it, they do require more information than a self-pay requires. One of the things that's required when insurance covers this surgery is you have to be able to prove that you've tried every diet on the planet. They're going to want documentation from your physician, primary care physician, or weight loss physician, whoever you've been working with, of the medications that you've tried, the different diet plans that you've been on. They're going to be looking for things like Medifast, things that can be prescribed by a provider to show that you have actually taken an opportunity to try and diet and do this on your own and you failed. So trust me, if this were covered by insurance, I would have 100 things to show the insurance company to say, I've tried Nutrisystem, I've tried Phenermine, I've tried Fen back in the 90s before it was illegal. I've tried everything under the sun to be able to lose weight, and I just can't. I have other conditions that cause me to retain this weight too, one of which is multiple sclerosis, and taking steroids for that packs weight on your body. So we'll see how my weight loss surgery goes along with prednisone. We'll see how that works out. But I want to talk a little bit about the tests that your surgeon, your insurance company, the bariatric physicians that you're working with should require for this surgery specifically. And a lot of these are required for any surgery because they're just important. So one of the first things that a lot of surgeons will do is to order an abdominal ultrasound, a pelvic ultrasound, to just make sure that if you've had abdominal surgeries, in my case, I've had multiple abdominal surgeries. I am full of scar tissue on the inside, and Dr. Carlton wants to know what he's dealing with, what he's working with when he gets in there. So I've got a lot of scar tissue and things like that. So the abdominal ultrasound, pelvic ultrasound is something important to just make sure that there's not anything going on in there that's going to preclude him from being able to get past the liver, get to the stomach, and to be able to do this surgery successfully. You do not want to find out that you've got adhesions or you have got liver disease and it's so enlarged that you can't even get to the stomach on the day of your surgery after they've already gone in. That you don't want that. So abdominal ultrasounds, they're going to ask for blood work. If you're afraid of blood work, guys, come on. This is a life-changing surgery. Your blood work can tell you so much, tell your physician so much about your health. They're going to stick you one time if you're afraid of needles. You might have 12 vials of blood that need to be taken. You're not going to pass out from 8 or 10 vials of blood. In most instances, let me say, unless you have something like vasovagal syndrome. You can Google that. People literally pass out when things happen, like blood work, needles, tattoos, belly button piercings. If you have that, this doesn't apply to you. So the complete blood count is important. That's how I just found out that I'm diabetic. New development. A week before my surgery, I am now diabetic like the rest of my family. They're going to look at your thyroid. My vitamin D is extremely low. I work from home. I don't get a lot of sunlight. Honestly, this summer was the least tan I've ever been in my life. I didn't have an opportunity to get out in the sun as much as I wanted to, and both mine and my daughter's vitamin D levels are low. So they're going to look at that. They're going to look at your B12. They're going to look at your B1. And those are different tests, different vials for different tests. So your complete blood count, what's called a BUN, which is your blood, urea, nitrogen, your cortisol, your creatinine, your electrolytes, your prolactin, your TSH, which is for your thyroid to see if your thyroid's working okay. They can order a cardiac catheterization, but most often they'll order an EKG to be done or an echocardiogram. I have heart issues in my family. My parents have both had open heart surgery, so an EKG was mandatory. It was done in my PCP's office. It took about 6 minutes to get a normal EKG, and it got faxed over to my bariatric surgeon, to Dr. Chad Carlton at Lone Star Bariatrics. They can order a colonoscopy if they like. They want to look and see if there's anything in your bowel that's going on that they need to be aware of, because depending on the type of bariatric surgery you have, with me, I'm having the sleeve, so there's no resection required. Again, these tests that they order and these things that they order to have done are generally specific to the type of procedure that you have, to make sure that you're healthy, that there's not going to be any issues with the surgery. A flex sigmoidoscopy goes along with the colonoscopy. They're going to go in there, look for polyps, look for things like that. They can order a mammogram. In my case, I did have to have a mammogram done because I'm 50. So it was important for them to get that mammogram, take a look at it, and just make sure that everything came back and was normal. They can order a pap smear if you're of age, childbearing age. They can order a pregnancy test. They want to make sure you're not pregnant before you're going in to have this bariatric surgery. That's a no-go. A pelvic ultrasound I covered already. At any kind of ultrasound down here where they're going to be doing the surgery, they're going to want to look and make sure everything's positioned the way it should be. Your pulmonary function. I have a history of pulmonary embolisms. Almost died in 2017 after a saddle PE. They're going to want to test your lung capacity and your ability to be able to recover from this surgery. PEs happen when you throw a clot. A lot of times it's from what's called deep vein thrombosis, or DVTs. That's why you wear compression socks on airlines. Clots can throw from anywhere in your body, and it makes you much more likely to have a pulmonary embolism post-surgery because there could be blood clots. So just keep that in the back of your mind. That's why they make you wear the boots in the hospital that squeeze your feet and drive you crazy. They have those that you can go home with, which I will have when I go home, that actually prevent the blood clots from happening in your legs. So that stuff's important. They do require clearance, a psychological clearance. This is a life-changing event. Absolutely life-changing and life-saving. That came out automatically. I've had to have a psychiatric consultation even when I've had my back surgery. I've had my back fused 360 degrees, and I also have a stimulator in my back that blocks pain. I had to have a psyche valve before those. With this surgery, especially if you're addicted to food, the doctor's going to want to know that you're going to be able to take a handle on and control those behaviors so that you don't self-sabotage. So it's important. Don't try to beat these tests, guys. Just be honest. When you're in there and they're asking you the questions, be honest about what your behaviors are, because if you're dishonest, it's going to flag. It's definitely going to flag if you're lying. You can research psychological testing. Some of it's done in the office. Some of them are questionnaires. It just depends on what your surgeon requires, but don't try to fake it out. Just be honest. If you're addicted to food, great. Let them know. What are you going to do? What kind of therapy are you going to have? What steps are you going to take to not continue to binge and self-sabotage after these surgeries? Those are important. The evaluation and clearance by a cardiologist, we already talked about EKGs. They can require more than just the EKG. They can require that you go to a cardiologist and they actually write that you're okay for this surgery. So a psychologist, therapist, cardiologist, evaluation and clearance by a pulmonologist. If you have a history of pulmonary embolisms, asthma, any kind of lung disease, they can send you to a pulmonologist and have them sign off that says this patient is healthy enough to have this surgery and will be able to recover as expected. Evaluation by a registered dietitian. That's going to be important. That's an important part of my step also, is meeting with the dietitian and understanding how to be a healthy eater moving forward. Am I going to fail at that 100% of the time? No. Am I going to fail 25% of the time? Probably. I enjoy my food. I enjoy my wine, but I'm not addicted to food, and I'm coming into this with a little bit of a different condition in that I don't eat and my body packs on the weight because it thinks it's starving. Not anorexic. Disclaimer. When I'm stressed, I don't eat. So they can give you a stress test, either they can put you on a treadmill, or they can give you a percentine thallium test, which is basically the chemical version of you walking and running on a treadmill. Basically, it's worse than actually doing it on a treadmill. I'm going to tell you, it is a horrible test to have. It's a horrible feeling. If you don't have a choice, if you can't walk on a treadmill, then that's going to be your option. It's going to be a chemical test that's going to mimic your heart rate and how you would perform walking and running on a treadmill. Documentation of weight loss. Your bariatric surgeon can require that your primary care physician send them documentation and notes showing that you're maintaining the loss that's expected over the course of treatment. In my case, my surgeon's going to follow me for a lifetime, and a lot of bariatric surgeons are taking that step now, that they're going to be the person that's going to be involved with my weight and my health post-surgery, so I don't have to worry about that. There are other tests. These are the ones that I just talked about, are the most common tests that you guys could be ordered, depending on whether you're self-pay, depending on whether you're using your insurance for this. You absolutely positively should have all your blood work done. Absolutely. You absolutely positively should have an EKG. If you don't have any underlying issues, those are the two things that are going to be required absolutely up front in order for you to get approved for this surgery. So I wanted to just, as a clinician, talk about that a little bit. And as a patient, I can let you guys know, I didn't have to have all the tests that I just went through. I had an EKG, I had a pulmonology test, and I had my CBC, my bun, and all of the blood work done. They took about 9 vials of blood from me. I was fine. My daughter had to have blood work that same day, and she was fine too. So don't think that these are barriers to you being able to get your surgery done. These steps are taken to make sure that you are healthy enough to tolerate this surgery. There's always a risk with anesthesia. There's always a risk with any sort of surgery. So you want to make sure that you get all of this taken care of and you get the proper testing done. And if you come across a surgeon that doesn't require you to do any of this, walk away. Find someone that does require you to have the appropriate testing done to make sure that you're healthy. So this is driving me insane. So let's talk about, today I'm on day 8 of my pre-op diet. I've been on the phone almost all day today, so I haven't gotten in as much protein as I would like, but I'll make up for it this evening. I'm taking my daughter out shopping and taking her out to get some dinner, so I'll probably get some soup and take a couple of protein bars with me just to make sure that I'm getting that in, and then drink a shake before bed. I am now down 13 pounds. I was 11 pounds a couple of days ago, but I'm continuing to lose, and I'm pretty excited about that. The shorts I have on right now, I can actually pull them down without unzipping or unbuttoning them, which is unseen in my house, so it was actually pretty exciting. But what I do know is, and a lot of people probably think about this, is, hey, I'm doing so well on this pre-op diet, and I'm drinking these shakes, and I'm eating these protein bars and water, and I've cut out all my sugar, and I've cut out the majority of my carbs. Maybe I should just do this for the rest of my life and not do the surgery. Not this girl. I have yo-yoed with my weight for the past 25 years, up and down, 30, 40 pounds, up and down. I know that I cannot do this on my own. I know that I don't have the willpower to do it on my own. This surgery might be considered the easy way out. I've heard that stated a lot of times by people. This is not easy. You're undergoing abdominal surgery. You have a risk of infection. There are a lot of things that go along with this surgery. So if anyone says it's the easy way out, okay, I'm going to take that easy way out, because I've tried everything, and the continued yo-yo dieting has ruined my health. It impacted my self-esteem at one point. So if this is the easy way out, then you bet your butt I'm going to take it. So 7 days from today, guys. Overall, like I said, I'm down 13 pounds. I'm sticking to the diet as much as possible, with the exception of drinking on Saturday. Don't drink. Watch my video from yesterday if you'd like to see how I felt on Saturday after I had a couple glasses of wine. Big no-no. Plus, you're shrinking your liver. Drinking was not a good idea, but I am human and I did it. And I was kind of pre-calculated. I kind of knew I was already going to do it. But other than that, that just talks a little bit about the tests that you guys should expect when you go in and talk to somebody. Most of the time, your insurance will cover the consultation with the bariatric surgeon. They'll cover you to go in and talk to them and talk about what you would like to have done, what procedures you'd like to have done. If your insurance doesn't cover the procedure, it doesn't cover anything that goes along with it, with the exception of an office visit. So just keep that in mind. But those are the majority of the tests that are required to answer a question that somebody asked on another page. I'm really grateful for the other YouTubers that have responded to me and have been so nice and left comments for me about my journey and about being a new YouTuber. So I appreciate you guys sticking with me as I get up to speed on these videos and doing all of that. So I'm gonna go ahead and end for today and head out and get my daughter from school, and we're gonna go hang out. I'm trying to get as much in as I can before surgery with her. So I hope you guys have a great evening. Subscribe below, turn your notifications on if you want to know when I post a new video so you can keep up with the journey. The hospital should be fun next week. Just kidding. I will film in the hospital as much as I can. I'm sure somebody will tell me to put my phone up at some point, but I'm pretty stubborn, and hopefully you guys will be able to see a very real version of how this feels and what it's like post-surgery. So thanks so much, guys. Subscribe below, turn your notifications on.